We were able to develop rules within our system that Curvo helped us implement that made our data collection much more accurate. We were one of the most accurate systems in going into the AAOS registry. My name is Kelley Young. I am the founder of Young Healthcare Consulting. Prior to that, I worked with Trinity Health for over 30 years, and that's where I had my experience with Curvo. I also currently work with UGuru Data Sciences, Inc., working on clinical informatics and supply chain informatics. I am located in Michigan, Southeast Michigan specifically. We needed to classify to the patient case level the usage of orthopedic implant. Our specific problem was we didn't know what exact parts were being used per case and per physician in our organization. Back then, and this is quite a number of years ago, it was very common to say, oh, Dr. Smith's hip, and the vendors would charge for that. And we had no idea what that was. So uniquely, again, it is the power of their classification systems. Curvo's been doing it very long. Their catalog is extremely robust, particularly in orthopedic and spinal implant. The second component is that construct, so that proprietary way of rolling up the information to tell specifically when you're looking at a patient case and you can benchmark what types of products were used per procedure. And their uniqueness in that construct component is where I think they have the differentiation. So as a customer, Curvo was very flexible. So one of the things that was unique with us is that we actually developed a web-based data collection system. And they were totally open to helping us do that. And again, all of our connections with our procurement system. The other thing is when they get back the information, it's clearly understandable and usable. And we also work very timely. So that information comes back to us very timely. So the short-term result was that we were able quickly to really help our supply chains. Our first focus was how do we help our sourcing department make sure that we're getting the best pricing that we could within the industry. So that was our first thing. Quickly it moved then to how do we help with value analysis and utilization. Then we also moved on to actually helping our revenue department by collecting the right detail at the patient case level. So it just kept building with the right amount of information that we had. The importance of a GIC is that, one, it's very consistent, and Curvo does a great job at that. The other thing is there is 5 levels deep into that GIC classification. So it's not just that you get a global classification, that you actually get material information on that and sizing information and specific usage information. So that 5-level deep makes it unique. With that uniqueness, they can roll that up again to what we call constructs, so that you know when you're looking at a total hip, was that hip cemented or not cemented? And I am comparing apples to apples to apples, the procedure, the construct, and then the detailed parts. And what that does is it makes you very trustworthy to your physician partners in what you want to achieve.